This itchy spot could mean up to 99% chance of cancer in seniors, if ignored. A silent warning sign every older adult should know. Itching is something we've all experienced at some point. Most of the time, it's nothing serious. Maybe dry skin, a bug bite, or just a mild irritation. So we scratch, move on, and forget about it. But what if that itch isn't harmless? What if it's your body's quiet cry for help? Especially for people over 60, unexplained itching, especially in certain areas, could be an early warning sign of something much more serious, including cancer. The truth is, many older adults ignore these symptoms. They dismiss the itch. They wait. And that wait could mean missing the golden window to detect and treat cancer early, when it's most curable. In this video, we'll explore the key areas of the body where itching may be a warning sign of cancer, based on real clinical cases and medical studies. If you're over 60 or care for someone who is, this information could be life-saving. Reliable health information can save lives. Like this video and subscribe to the channel to keep learning clear, accurate, and expert-backed insights every week. So let's take a closer look at the types of itching that should never be ignored and how you can take action before it's too late. First, let's be clear. Itching isn't always something to worry about. In most cases, it's caused by common things: dry skin, a reaction to cosmetics, cold or dry weather, insect bites, or even stress. But when the itch lasts, and when it shows up without any rash, redness, or clear allergy signs, that's when it becomes something more. That kind of itching is your body's quiet alarm, a subtle knock at the door you shouldn't ignore. For older adults, it's even more important to pay attention. As we age, our immune system weakens, and the signs of illness often become harder to detect. Unusual symptoms can easily be mistaken for just another part of getting older. That's why recognizing abnormal itching early isn't just about detecting cancer. It's about improving quality of life, catching serious conditions before they advance, and preventing dangerous complications down the road. Medical studies and clinical experience show that there are 7 key areas on the body where persistent itching may signal serious cancers. Here's what every older adult needs to know. Persistent itching around the lower abdomen or near the navel without accompanying signs like rash, redness, or typical skin irritation may be a hidden warning sign of serious conditions, including ovarian or colon cancer. When tumors develop in these areas, they can directly irritate nearby nerves or release inflammatory substances, causing a deep, uncomfortable, and persistent itching sensation. Itching may not be a common symptom, but it is significant because it reflects an underlying disease process inside the body. In addition to itching, patients may experience other symptoms such as dull abdominal pain, bloating, a feeling of fullness, or unusual changes in bowel habits like prolonged constipation or diarrhea. Some cases even present unexplained weight loss or persistent fatigue. Although these symptoms are not specific, when they appear together with itching in the lower abdomen, prompt medical attention is essential. If itching lasts more than 2 weeks and does not improve despite standard skincare measures like moisturizing creams or anti-itch treatments, you should consult a specialist for thorough examination and accurate diagnosis. Early detection of abnormal signs greatly increases the chances of effective treatment and helps prevent serious complications later on. Persistent itching around the neck or the skin surrounding the neck, especially without typical signs such as rash, redness, or common allergic reactions, can be a warning signal of serious conditions, including thyroid cancer or lymphoma in the neck area. Tumors or abnormal growths in the thyroid gland, lymph nodes, or soft tissues of the neck may put pressure on or irritate nearby nerves, causing a persistent, uncomfortable itching sensation that can interfere with daily life. Along with itching, patients may also notice additional symptoms, such as swollen lymph nodes in the neck, a feeling of tightness or discomfort when swallowing, mild pain, or a heavy sensation in the neck. Though these symptoms can be subtle and easily mistaken for common infections, they are important signs that may indicate a serious underlying condition. If you experience these symptoms along with prolonged itching in the neck area, it is important to see a specialist promptly. Doctors may order imaging tests such as ultrasound, CT scan, or MRI to evaluate the condition of the thyroid gland and lymph nodes in the neck. In some cases, a biopsy may be necessary to accurately determine the nature of any abnormal growth, allowing for an appropriate treatment plan aimed at preventing disease progression and protecting your health. Recognizing and not ignoring unusual signs like persistent itching around the neck can help detect hidden cancers early, increasing the chances of successful treatment and improving quality of life. The lower legs, both shins and calves, are common sites of persistent itching in people over 60. If itching worsens at night without rash, dry skin, or new skin products, it might signal Hodgkin's lymphoma, a cancer of the lymphatic system. The lymphatic system helps filter toxins and fight infections. Cancer cells there release chemicals that inflame nerves, causing deep, burning itch while the skin surface looks normal. For example, Michael, 72, suffered severe night itching for 6 months. Initially, he thought it was dry skin, but after developing fatigue and unexplained weight loss, he was diagnosed with Hodgkin's lymphoma. His story shows why long-lasting leg itch should never be ignored. Itching between the shoulder blades or upper back can be a sign of pancreatic cancer. This itch is deep and persistent, often mistaken for dry skin, poor posture, or clothing irritation. Pancreatic cancer is dangerous because it's often detected late. Tumors may block bile ducts, causing bile salts to build up in the blood. This buildup not only causes jaundice, but also irritates nerves in the upper back, creating an internal itching sensation. John, 65, experienced weeks of upper back itch without jaundice or pain. Only after liver function tests was his pancreatic tumor discovered. Other symptoms may include dark urine, pale stools, and fatigue. Early detection is key to better treatment outcomes. Itching on the chest, particularly near the breastbone, without rash or allergy, is another important warning sign. Some breast cancers, like Paget's disease of the nipple, a rare form, can begin with itching or mild burning around the nipple. This itch is often mistaken for simple skin allergies, delaying diagnosis and treatment. Tumors near the chest wall may also irritate nerves or increase blood flow, causing prolonged itching. If you or a loved one have itching that doesn't improve after weeks of anti-itch creams or allergy meds, especially with a deep burning feeling, see a specialist immediately. Facial itching, particularly near the nose and eyes that isn't caused by weather or cosmetics, may point to blood cancers like chronic leukemia or lymphoma. This happens because cancer triggers the release of histamine and inflammatory chemicals that irritate sensitive facial skin. Patients often rub their nose frequently without cold or allergy symptoms. If you also feel persistent fatigue, slight weight loss, or general unwellness, it's time for a thorough health check. Lastly, itching on the palms of the hands and soles of the feet, especially at night, can be linked to liver cancer or bile duct disorders. When the liver is damaged or affected by cancer, toxins and bile salts build up in the bloodstream. These irritate nerve endings in sensitive areas like the palms and soles, causing a deep, intense itch that feels like it's coming from inside your body. This symptom not only causes discomfort, but also disrupts sleep. If the itching lasts more than 2 weeks, doesn't respond to allergy meds or creams, and you notice jaundice, dark urine, pale stools, or ongoing fatigue, see a doctor for liver tests and further diagnosis. To understand why itching can be a warning sign of cancer, we need to explore the complex biological processes inside the body. Itching isn't a random sensation. It's created by the nervous system and chemical mediators working together. When the skin or tissues are irritated, sensory nerve cells send signals to the brain, producing the feeling of itch. In cancer cases, tumor cells don't just grow and spread, they also release chemicals like histamine, serotonin, and cytokines. These are inflammatory mediators that can stimulate sensory nerves in the skin or deeper tissues. In certain cancers, such as lymphoma or leukemia, the uncontrolled growth of malignant cells in the immune system disrupts normal production of inflammatory substances. This leads to persistent, unexplained itching. These chemicals may directly activate itch nerve endings or cause inflammation in nearby tissues, resulting in chronic itching sensations. That's why itching isn't always caused by external factors like dry skin or allergies. It can be a sign of internal physiological and biochemical changes linked to serious illnesses, like cancer. Apart from the location of the itch, accompanying symptoms play a crucial role in warning patients about potential cancer risks. Night sweats. This is when the body produces excessive sweating during sleep, soaking clothes and bedding. When persistent itching is paired with night sweats, especially in older adults, it could be a sign of lymphoma or other types of cancer. Unexplained weight loss. Cancer often causes the body to burn energy abnormally due to rapid growth of malignant cells and inflammatory responses. This leads to rapid weight loss that can't be explained by diet or exercise. Persistent fatigue. Feeling tired that doesn't improve with rest is another warning sign of declining health caused by cancer. Changes in skin color, jaundice, changes in pigmentation, or paleness often accompany itching when organs like the liver or pancreas are affected. Changes in urine and stool color. Dark urine or pale stools may indicate bile duct obstruction or liver damage, signs that require serious attention. Rashes or unexplained bruising. In some cases, blood cancers can cause unusual bruising or unexplained bleeding on the skin. When these symptoms occur alongside persistent itching, they help doctors identify the risk and guide patients toward proper testing and diagnosis. Itching is common, but if it persists without a clear cause and doesn't improve after using creams, lotions, or allergy medications, especially when accompanied by symptoms like unexplained weight loss, persistent fatigue and weakness, yellowing of the skin or eyes, dark-colored urine or pale stools, low-grade fever that lasts, unusual bleeding or bruising, you should never ignore these warning signs. This is the time to see a specialist for a thorough evaluation and necessary tests to detect serious health conditions early, including cancer. Early detection of cancer is the key to improving treatment success rates, extending life expectancy, and enhancing quality of life. This is especially important for older adults who need to closely monitor their body's warning signs. When a patient shows signs of unusual itching, doctors will carefully review detailed questioning about when the itching started, its location, frequency, and severity. Identifying any accompanying symptoms such as unexplained weight loss, low-grade fever, fatigue, swollen lymph nodes, or skin bruising, bleeding. Investigating personal and family medical history, allergy history, chemical exposure, or any chronic diseases. Blood tests to assess liver and kidney function, inflammation markers, blood cell counts, and cancer indicators. Imaging studies like MRI, CT scans, or ultrasounds to detect tumors or abnormalities in suspected organs. Biopsy, which involves taking a tissue sample from the suspicious area for precise cancer cell analysis. Based on these diagnostic results, the doctor will develop a personalized treatment plan. Common treatment options include tumor removal surgery, chemotherapy, radiation therapy, and newer immunotherapy approaches. Most importantly, patients must follow their doctor's guidance and maintain a healthy lifestyle to support the treatment process. Itching may seem like a simple symptom, but in older adults, it can be an early warning sign of serious illnesses like cancer. Understanding the biological mechanisms, recognizing specific itchy areas, and paying attention to accompanying symptoms can help patients and doctors detect cancer early and start treatment promptly. Persistent, unexplained itching may be an early symptom of serious conditions, particularly certain types of cancer, such as liver, bile duct, lymphoma, or blood cancers. Early diagnosis and treatment not only extend life expectancy, but also significantly improve quality of life. Consider itching as a reminder, a signal from your body that shouldn't be ignored. Being proactive by listening to your body, seeking medical advice when unusual signs appear, maintaining a healthy lifestyle, and getting regular health checkups are key steps in effective cancer prevention. Educating yourself and recognizing these warning signs not only protects your own health, but also raises community awareness, helping your loved ones avoid the serious consequences of disease. If you or a loved one is experiencing these symptoms, don't ignore them. Seek medical attention at a trusted healthcare facility as soon as possible for proper diagnosis and monitoring. You deserve a healthy, full life free from the threat of silent but dangerous illnesses. Protect yourself and your family by equipping yourself with knowledge and a commitment to healthcare starting today. If you found this information helpful, don't hesitate to share it with your loved ones, especially the elderly in your family. Help them recognize these silent warning signs so they can get timely care and maintain long-lasting health and happiness. Reliable health information can save lives. Like this video and subscribe to the channel to keep learning clear, accurate, and expert-backed insights every week.